Hi again. It's been a couple months and a few things have happened since then. Since my last video. Um, let's see. Let me think back to October. Um, I did stop treatment so that I could get onto the clinical trial. And also I had to get my two bottom wisdom teeth taken out, so I couldn't be on the Avastin um, because of bleeding. So I had to get off of that. I got off of everything, the chemo infusion. The last treatment was probably mid-October. So I had my wisdom teeth out the beginning of November, and then that went well. So it's been about a month. So they called and they said that they were going to start the trial medication on December 3rd. So I had made plans. I called to see where I could stay. Thankfully, the American Cancer Society was able to put me into a hotel pretty close to the hospital. So I'm actually here now. I'm in a hotel in Houston. And so when I got here, they had told me that because of Thanksgiving, I don't know what, something happened with their scheduling, they would have to push it back a couple of days. So I was going to start the treatment on Thursday instead. I think that's the 6th. But what happened was they called me again and said, let's do your blood work first. So I just went in today to do the blood work to make sure everything was okay. And then she called me a little while ago, a couple hours ago, and said that my white blood cell count was still low, and they were expecting it to be higher than it was just coming off of chemo. They expected me to recuperate from that, and they thought everything was going to look better. That's the only thing that I believe. The white blood cells and red blood cells are still low, and I believe that is probably my normal, even though I going through chemo and everything. Even before that, when I would get blood work, it things were still low. All my levels were still low. And then I just got over a cold, and maybe that had something to do with it too. I'm always getting colds and this and that. But so what they wanted me to do was to wait again, and they want to postpone it until next week. So she said they're planning on starting everything again, doing more blood work, visiting with the doctor, starting the treatment next Tuesday. So, I have this hotel for a few days. I have to call them tomorrow, ask them if I can. What I might do is just leave and then come back. Leave tomorrow. And my doctor's appointment was supposed to be tomorrow, but what he's going to do is just call and discuss the blood work with me. Because I told him, I said, I really would like to talk to him first. I want to talk to the MD Anderson doctor. I want to talk to my doctor at home, which is back in Louisiana. And then just kind of think of, come up with a plan. Now, I don't even know if things are going to look better next week. And if not, then that means I'm not going to be a candidate for the trial. And I've been waiting. I just feel like it's been forever. So then we'll have to just figure out something else, another type of treatment, which I know there are a couple different targeted treatments besides chemo. Um, so, and from my last scans, which were done about 2 or 3 weeks ago, um, my hand's getting tired. Um, things look pretty stable, so that's good at least. But I do need to get on something. I need to start some sort of treatment soon. So we're gonna have to figure this out. I'm gonna talk to everybody tomorrow, and if what I asked them was, instead of coming back to do blood work here next week, because that's a 6-hour drive back and forth, if I can do that at home, because I know they like to do everything here in their clinical trial department. But if I could at least see where the levels are at home before I come back, then I think they'll be okay with that. Um, so yeah, so far I still have small nodules in my lungs. I'm maybe around 6 or 7 spots, which I don't really have any symptoms right now. And then the one spot in my liver is the largest, but it's still about 1 centimeter or a little over a centimeter. And everything in my lungs is a few millimeters big. But so the video cut off because someone was calling, and as I was saying, the tumors that I do have are pretty small. They did find another lymph node that is enlarged in my abdomen area, so we need to keep an eye on that. And so tomorrow I have to call everybody. I'm gonna talk to the doctor here. I'm gonna talk to my doctor at home. I'm gonna do my blood work at home. Before I drive back, hopefully we can do everything this Tuesday coming. I don't know, everything's been changed so much. I've never heard of anything being so complicated, but I don't want to let it go for much longer. So we will see. I have some hair again. It never did fall out completely, but I was balding, especially on the sides here. I never knew how much gray I had. I knew I had some gray here since when I was in my 20s, it started to turn gray right here. But I would color my hair just about every 6 weeks, like a dark brown. So I'm not used to a lighter color, but I like it. I like my hair. I think I'm gonna keep it short. I'm just over the long hair or mid-length. It's like here. So if you have any questions about anything, just let me know, and I will keep you guys updated. Talk to you later.